People take a hit of sugar, refined carbohydrate, or addictive food substance of choice, feel high or numb or calm. And a lot of people use the term numb for that experience. But what happens is, in addiction, like gravity, what goes up comes down. So what happens is, for that below baseline feeling, is that Joan was talking about it yesterday. The pancreas produces insulin. The insulin grabs the sugar or the refined processed foods out of the bloodstream, the glucose, and really puts the body into deficit because it overdoes its job. It does its job too well. So we go from a high, below baseline, and start suffering when we go below baseline. We feel lethargic, depressed, shame, fear, guilt, anxiety. I think there was a lot of anxiety in the work that we were exposed to this weekend. So we get these low feelings, and so when there's little X marks the spot, people eat again. So this is kind of how it looks. So what it is, this is really a picture of progression, because eventually people never get back to baseline. Food addicts eat to feel better and always feel worse. So eventually, food addicts are operating out of some kind of physical, emotional, spiritual, mental basement, feeling terrible when the consequences become so overwhelming. And here's the dilemma. The food addict is powerless to control his or her physiological response to the addictive foods. Now, here are some signs and symptoms. And I want to tell you kind of a cute story, because I was so touched by the stories of the children that are doing so well in Yvonne Butler's school. But one time I went to a school, and the health teacher had asked me to present on the signs and symptoms of food addiction. So I had these wonderful overheads. They were like an artist had done them for me, and they were all these wonderful characters demonstrating the signs and symptoms of food addiction. Excuse me. And so the first class loved them. This was like 9 o'clock in the morning. Those kids loved it. They knew. They had classmates that were in trouble. They had relatives that were in trouble. They knew what, they paid attention. They asked questions. They were fabulous. Second class I went to, still 11 o'clock in the morning. Same thing. These kids were alert, interested, on the ball. Then we had lunch. I took my overhead into the after lunch group, and the kids were screaming at the teacher, and the teacher was screaming at the kids, and I started to present, and they were still all screaming, and I said, I don't think this is working, and I left, and I don't think till today they know I'm gone. What kind of lunch were those people eating? Yes, thank you. It's so much like that. Thank you, Annie. So, food addicts use food to relieve tension, but it's only temporary. Preoccupied, loss of control, we talked about those. Uses alibis and rationalizations to excuse their use. There's a growth of irrational behavior patterns. Breakdown in human relations as friendships. And you know, part of the breakdown is due to that isolation. We have to eat in isolation, you know. We don't want people to see how we eat. It's all so secretive and hidden. And you can't hide in your bedroom or living room or wherever you're hiding and have successful friendships or relationships with family members. So that secret eating, which I think of this young woman who had the flu, and she was so terribly sick that she had to have her doctor call in a prescription for her. She was very ill. And she asked her husband if he would go get the prescription for her. And she was a food addict, and she was out of binge food. So when he went out to get the medication, in her weakened, sick condition, she got dressed and went to the convenience store to get binge food. That's how driven and how secret we are about. She could have asked him to bring some back, couldn't she? But she had to hide it. She had to keep it secret. And then there's increasing physical disability and loss of spiritual contact. So that's kind of the progression of the signs and symptoms. This is just a model of the Jellinek chart that we've created. And, well, I guess I went a little too far. And it's just shows how food addiction is a downward path and recovery is an upward path. And Dr. Jellinek, I think he's from Holland, designed this model for alcoholism, and we've used it. We've taken it over for food addiction. The early stage is tolerance. I just want to talk about tolerance for a minute because I don't think it's been addressed too much this weekend. There's a reaction to toxic foods because food, when we looked at the high created and then the low below baseline, what we were looking at is a body that was in crisis. And that insulin response is really responding to a toxic substance that's been ingested. So in the early stages, there's acute reaction to the toxic food. And then eventually the body adapts to it, resulting in increased tolerance. And it's the body's ability to endure toxic substances. Increased tolerance means the food addict can eat large quantities of trigger foods. And tolerance is the reason why we now have 400-pound people. And I want to say when I first started in the field in the early 80s, a lot of food addicts were coming into recovery at just slightly under or just slightly over 200 pounds. And then it got so the typical food addict coming into recovery was around 250. And now it's not unusual to see 300-pound food addicts. And I have someone in my own hometown who is way over 400 pounds. And that's really the picture of tolerance. That body has learned to tolerate that substance. In the middle stage is dependence. There's progressive loss of control. And this is when it starts to be more obvious. The middle stage of the disease addiction, where we start to notice that there's something wrong. Early stage, we don't notice that there's much wrong. Later stage, there's increasing dependence, and it's starting to show. It means the cells have changed to tolerate higher levels of addictive foods and have come to depend on them. And then in the chronic late stage, marked deterioration, physical damage, emotional problems, thinking problems, behavior, and social problems. In the late chronic stage, there's physical, psychological behavior, and social deterioration. So it's progressive, and it progresses till it becomes chronic and has really affected all the systems of the body. So there is system damage. We can name all the systems of the body that are damaged by food. I probably, if I pulled the group here, everybody'd have a different medical condition related to the consumption of bad food. However, I don't know if Nancy's here. Nancy Appleton gave me a wonderful list. She allowed me to use a list from her book of 87 conditions that are related to the use of sugar. So I always appreciated that, and I refer a lot of people to those pages, Nancy. Thank you. So if this is my book with Nancy's work in it. So if anybody wants to look at all those 87 issues around food addiction, please feel free. And we know there are horrible health complications. And I just want to remark, there was an elderly gentleman, actually 4 elderly gentlemen that came into recovery into one of our 12-step programs. And each of them did well. They did very well. But I recall one of them particularly, and he's still around. He's still plugging away. But when he got abstinent, within the first year of his abstinence, he came off of 13 13 medications. So some of this damage must reverse itself because he came off of 13 medications. So what good news that recovery works, and it works to heal the body, mind, and spirit. Withdrawal is a sign of addictive disease, and that's why we say that the abusers don't have withdrawals. Acute withdrawals last 3 to 10 days, and Joan said yesterday 4, and that's exactly what it is. On day 5, food addicts usually start to feel better. Food addiction is like alcohol, cocaine. It's driven by craving, and the withdrawal isn't too horrible, whereby heroin and nicotine, the disease is driven by avoidance of withdrawal, and the withdrawals are horrible. And I'm here to say that withdrawal from nicotine is a horror story. It was the worst thing I ever went through in my life, and it lasted for years. I'm not sure I've recovered yet. It was awful.